Today, we'll be looking at anxiety disorder briefly. My name is Dr. Peter Boakye-Boama. I'm a medical doctor and a resident in the psychiatry department, Kumasi, Ghana. My email is peterboakye27@gmail.com. Outline of the presentation. 1. Definition. 2. Etiology and epidemiology. 3. Pathophysiology. The types and their details. 5. Complications. 6. Treatment. And 7. Prognosis. Definition. Anxiety is a common human emotion characterized by feelings of worry, nervousness, unease, typically about an event or something with an uncertain outcome. Anxiety is a normal response to stress and can be beneficial in preparing for challenges. But when excessive or persistent, it becomes a problem. Now, anxiety disorders. They are a group of mental health conditions characterized by excessive worry, fear, and unease that interfere with daily life. Etiology of anxiety. The etiology of anxiety is complex and likely involves a combination of genetic, environmental, and psychological factors. While the exact causes are not fully understood, research suggests that an interaction between these factors play a significant role in the development of anxiety disorders. The etiology in details. 1. Genetic predisposition like family history, specific genes and epigenetic factors. Environmental factors like traumatic experiences and stressful life events. Psychological factors like learned behaviors and cognitive patterns as well as personality traits. 4. Substance use and abuse like drug and alcohol withdrawal, and other factors like age and gender and medical conditions underlying play a role. Pathophysiology. The pathophysiology of anxiety involves a complex interaction between brain circuits, neurotransmitters, and genetic and environmental factors that lead to exaggerated or inappropriate stress response. Essentially, the body's natural fight or flight response to perceived stress is triggered too easily or intensely, leading to the symptoms associated with anxiety disorders. Types and details. We have generalized anxiety disorder, GAD, panic disorder, social phobia, specific or simple phobia, and then obsessive compulsive disorder, OCD. Now, the details of the types. 1. Generalized anxiety disorder. This is characterized by excessive worry and feelings of apprehension about everyday events and problems, with symptoms of physical and psychic tension causing significant distress or functional impairment. It is more common in women than in men. The diagnosis of GAD, the criteria. 1. At least 6 months history of excessive worry and anxiety with marked tension and apprehension about everyday events and problems, either at work or in school, or at least 4 of the following symptoms: palpitations, sweating, trembling, chest pain, derealization, fear of dying, numbness, chills, among others. Investigations in GAD management. Investigations include a full blood counts, BUN creatinine, glucose, TFT, ECG, chest X-ray, among others. GAD-7 scoring system can be used for psychological investigation. For treatment, is generally poor with remission rates approximately 30%. For psychosocial, psychotherapy can be done and CBT can be done. For biological treatment, SSRIs like citalopram, escitalopram, fluoxetine, and sertraline can be used. Beta blockers such as propranolol can be used. Benzodiazepines for somatic symptoms such as clonazepam, lorazepam can be used. For psychic symptoms, buspirone can be used. Other medications include quetiapine. Panic disorder. Here, there are recurrent panic attacks, which are not secondary to substance use, medical conditions, or psychiatric disorder. It is very important to note that there must be persistent worry of the episodes occurring. So, generally, what is a panic attack? It's a period of intense fear characterized by a constellation of symptoms that develop rapidly, reaching a peak intensity in about 10 minutes and generally do not last longer than 20 to 30 minutes. Panic disorder are 2 to 3 times more common in women than men. That is, the female to male ratio is 1:2 or 1:3, and the peak age is between 15 to 24 years. The diagnosis of panic disorder, the criteria: a period of intense fear characterized by palpitations, sweating, trembling, chest pain, derealization, numbness, chills, with symptoms developing rapidly over 10 minutes and usually subsiding over 20 to 30 minutes. Investigations in panic disorder include full blood count, BUN creatinine, glucose, TFT, ECG, among others. For psychosocial investigations, the Beck's anxiety scale, the Hamilton inventory, among others, can be used. Treatment of panic disorder. For psychosocial, we have relaxation techniques and CBT. For biological, we have SSRIs like escitalopram, and sertraline. TCAs like amitriptyline, imipramine. Benzodiazepines like clonazepam and lorazepam, among others. Social phobia. Here, there are symptoms of incapacitating anxiety restricted to particular social situations, leading to a desire for escape or avoidance. They are usually not secondary to delusions, substance use, medical conditions, or other psychiatric disorder. Signs and symptoms of social phobia include somatic symptoms such as trembling, dry mouth, and sweating, that's perspiration. Psychological symptoms like excessive fear of humiliation, embarrassment, blushing, or others noticing how anxious they are. And it must be noted that thoughts of suicide are relatively common. Investigations in social phobia is the same as with panic disorder and other anxiety disorders. And the treatment, psychosocial, we have CBT, which is considered as first line in combination with an SSRI sometimes. And biologically, SSRIs can be used such as escitalopram, sertraline, beta blockers such as propranolol, benzodiazepines such as clonazepam, lorazepam, and venlafaxine. Specific phobia. This is usually in response to a specific object or situation. The male to female ratio is 1:3. The top 20 phobias include arachnophobia, agoraphobia, aerophobia, monophobia, among others. Management of specific phobias. Psychosocial approaches include behavioral techniques such as desensitization and graded exposure, then cognitive techniques such as coping skills. Biologically, they are generally not indicated unless in severe anxiety symptoms or severe avoidance. Benzodiazepines for acute symptoms of anxiety, beta blockers to reduce autonomic arousal, and SSRIs if there is comorbid depression. Obsessive compulsive disorder. This is characterized by obsessions and compulsions, where obsessions are ideas which are recognized by the patient as their own but which are experienced as repetitive, intrusive, and distressing. Compulsions are behaviors or actions which are recognized by the patient as unnecessary and purposeless, but they can't resist performing them. It should be noted that the male to female ratio is 1:1. Common obsessive compulsive disorders, thus obsessions, include contamination, order, safety, doubt. Then compulsions include checking, cleaning, counting, touching, and hoarding. Management of OCD include psychotherapies like CBT, behavioral techniques, and biological like SSRIs, which are the first line, TCAs like clomipramine. ECT can be considered if suicidal. Other stress-related disorders include acute stress reaction, which is a transient disorder lasting hours to days, which occurs to an individual as an immediate response to an exceptional stress like natural catastrophe, major accident, among others. Treatment generally involves the removal of the stressor, and it usually lasts a few hours, but if it continues, it usually diminishes after 72 hours. PTSD symptoms include re-experience of the event, avoidance, negative mood, and hyperarousal. Treatment includes CBT, simple measures like support, and pharmacotherapy like SSRIs. Complications of anxiety includes depression, substance use, physical problems like digestive issues, headache, cardiovascular issues, social isolation, reduced quality of work, and risk of infection, among others. Prognosis. The prognosis of anxiety disorders is generally good, with most people experiencing significant improvement with appropriate treatment, while some individuals continue to experience chronic symptoms with periods of remission and relapse. At this juncture, we come to the end of our presentation, and as usual, our quote is protect your mind, for it is your home. Thank you very much.